So in today's show, we're going to be going over adrenal fatigue. I'm Dr. Zigler, and I'm actually interviewing my primary care physician, Dr. Mark Newman. And before we begin the interview, make sure you subscribe to his channel by clicking that link right above my head. So let's jump into the interview about adrenal fatigue, but first let's welcome Dr. Newman to our channel.
Thank you. Glad to be
So
here,
tell
Travis.
viewers a little bit about yourself.
We do what we call anti-aging and functional medicine practice. My background initially was as a chiropractor. I continued in education as an osteopathic physician, and now we focus primarily on helping people to live, truthfully, a long and healthy life and hopefully die suddenly. We want to maximize your lifespan, maximize your health while you're alive.
And I love your tagline or your slogan for your practice and for your channel as well. Could you let viewers know what that is?
Well, we believe that when you change your health, you'll change your life, and our goal for you is to live a long, healthy, vibrant life, maximize your health.
So the reason that I picked Dr. Newman over most primary care physicians is because I like the philosophy of everything about his practice. And I was looking for practitioners in Temperance, Michigan, which is just north of Toledo, Ohio, when we were living here. And quite honestly, I've moved away from Temperance, Michigan, and I still come back to see him. And I don't live close anymore. I live about 28 hours away or so. So I don't live that close at all. So I still come see him today. So without further ado, let's jump into the content that you came here for. And I took some questions from you, the viewer. And if you have any questions for Dr. Newman or myself, make sure you put those down in the comments below. So the first question is just generally, what is adrenal fatigue?
Okay, we'll talk about that, but let's just tell you what the adrenal glands are, because
that's a good
a lot
start.
of people aren't even certain, what are the adrenal glands? Well, the adrenal glands are small glands that sit on top of your kidneys, maybe walnut shape, walnut size. They produce, store, and release multiple hormones. The hormones we primarily focus on are cortisol and DHEA. We refer to cortisol as the hormone of stress. And obviously, if you're alive, you've got stress. And we tell folks that stress can be physical, mental, spiritual, emotional, financial, relational, and professional. And so, depending on the amount of stress you have and how your body deals with it, if you become overwhelmed with stress, then you come into a condition called adrenal fatigue, where your body, its ability to produce and release cortisol and help your body deal with stress is depleted over time.
Yeah, that makes perfect sense. So from my understanding, that it's not the stress is great, cortisol is great. It's our fight or flight. It's what pretty much helps us maintain a healthy lifestyle. The problem is that we're so stressed out all the time now that cortisol is raised chronically. And then I always refer to the teacup analogy. If your teacup it's always filling up with cortisol. It's when it starts to overflow is when we start to have that problem. And so that's what you're talking about with adrenal fatigue, is that teacup's overflowing, we're chronically stressed, and then it leads to a whole plethora of other disease.
Right.
Yeah, exactly. So what do you recommend if somebody's sitting in your chair with adrenal fatigue? How do you treat adrenal fatigue?
Well, there's many things you want to do. First and foremost, you want to try to reduce the stress in your life. And I always say that all of us have people, places, or things in our lives that are overwhelming us. Travis would know that. I would know that. That's something that we all have to know personally. So that's absolutely the first step. And then, of course, we talk to our patients about diet, exercise, supplements, nutrients, and so forth that can help their bodies cope and restore the ability to function properly.
And I love stress management. It's a lot of things that people don't really look into it. And one of my favorite things to do is gratitude journaling. A lot of us aren't great, we don't have gratitude in this life, and we're constantly focusing on the negative, like watching the news. And so one thing I do before I go to bed every night is I write down 3 things that I'm grateful for. And that just makes you look for the positive of that day, but then it resets your mindset at night. When you wake up, you're gonna be more positive in the morning, and you're gonna look for the good in people instead of the bad. So I love that. You already answered the next question from viewers, which is what causes adrenal fatigue, which is constant stress. When you have a patient in your chair, how do you diagnose adrenal fatigue?
Well, when we have a patient in the office, we specifically do testing for that, and we do saliva testing. Your cortisol actually, it runs in a cycle. It should be highest in the morning and then taper down, bottom out around midnight, and then with a good night's rest, it builds back up again. So when they do saliva testing specifically to look at what's going on with their cortisol levels, we've got a really nice pattern. They do 4 samples throughout the day, and then we can literally look at a graph of how that is or isn't functioning.
And so if somebody has adrenal fatigue, will that cortisol be spiked pretty much throughout the whole day?
That would be their initial response. Now, over time, if we see that person that's just totally wiped out and fatigued, they're going to be almost flatlined.
Okay, so it flatlines. Okay, good to know, because I was thinking opposite. So, all right, can adrenal fatigue, this is a great question, can adrenal fatigue cause panic attacks?
Well, anytime that you've got dysfunction in your body, whether it's hormones, blood sugar, blood pressure. You know, when the body can't adapt properly, anything can go wrong.
Yeah.
Literally, you could be depressed, you could be anxious. You know, everyone's individual response can vary.
And this kind of answers the next question too, which is from a viewer as well. Can adrenal fatigue kill you? And it kind of goes along that same line as panic attacks.
I'm not sure if I would say, you know, well, they say, you know, obviously stress can just, you know, run you right into the ground. So I would probably say that, you know, if you become overwhelmed with stress and your body cannot no longer adapt, then we very well could say that, you know, that could actually lead to your demise.
Yeah, inflammation. I mean, it's all causing inflammation in our body, and inflammation is the number one cause of disease. And
it is
the number one cause of death, so I could see that. So the next question is the keto diet okay for adrenal fatigue?
Well, the keto diet, I always say this, and let's just talk about a diet as a whole. First of all, we tell our patients that the bulk of our patients will maximize their health if they minimize most of their grains and dairy and then focus on healthy proteins, fruits, and vegetables. The vast majority of Americans are either overweight or obese, so we always try to keep that simple, stupid concept there. If they will take that to the next step, many patients will find that keto diet, where they're focusing more on healthy fats and proteins, gives their body a really nice response in how to deal with stress and just deal with their overall health. And a lot of folks will see a weight loss with it, and then they'll feel much better.
Yeah, and I agree. Keto is one of the most misunderstood diets. A lot of people treat it like the Atkins of the 90s, where you're just eating a lot of meat and cheese and a lot of high fats. But you said it best, focusing on those healthy fats. And my favorite healthy fat, avocado.
There you go.
Eating avocado,
Excellent.
It's got a lot of carbs in it though, but the dietary fiber is right up there with it. So I don't consider carbs that much, but that's just me. But I eat more of a vegan keto. And so it's a keto green, as some people call it. So a lot of green vegetables, a lot of healthy fats. I drink a nice healthy brain octane oil coffee in the morning, and then I eat a green smoothie for lunch. And then at dinner I use vegetables stir-fried in a lot of healthy oils. So that's kind of my keto approach. And as you've seen from my blood work, which we'll go into in another video, it's really cut my antibodies in half for my thyroid condition.
Yes. Yes,
and so keto is very misunderstood. So make sure that if you are looking into keto, that it's not just meat and cheese. It's a healthy greens keto with a lot of vegetables and fats. So just
I want to say too,
yeah.
I know you personally, you could probably tell the viewers that even though you're really fit, you did see a loss of weight even from that. You know, you fine-tuned your body with that diet.
So I was running, I'll tell my brief history in 10 years in 1 minute. So I went vegetarian back in 2011 when I was diagnosed with high cholesterol. I had a cholesterol of about 250, and it was about 230 to 250, somewhere around in that area. So I went vegetarian and dropped it down to 130. And so literally dropped 100 to 150 points just by going vegetarian. And then something was just off. I was about 180 pounds and I felt okay. And I was running marathons and half marathons. And then I took a food inflammatory test, found out what I was sensitive to, and I was eating healthy, but then I found out my sensitivities, eliminating those as well. And then I went down even further. I'm down to 160 now. And I was at 190 at one point, and it's still healthy. But I had high cholesterol. Right. And now my cholesterol is on the high side of normal, but it's still normal. And it's the healthier cholesterol versus the bad cholesterol.
Right.
And it's because we focus on those healthy oils. Right. So if you had to give some specific foods that are good for adrenal fatigue, what would you say for that one?
I would go right back to what I said earlier there. I would try, I want people to try to focus on healthy vegetables, even cruciferous vegetables, focus on those. Remember, with your vegetables, you're going to get all your micronutrients and you're going to get fiber. Fruits, most patients, we tell them, try to get about 2 to 3 times as many vegetables as fruits, and then focus on their healthy proteins. And again, I give a generality saying chicken, fish, turkey, eggs, beans, nuts. Those foods should be boiled, broiled, or grilled preferably.
Yeah, I love that. So if you love this video on adrenal fatigue, make sure you give that big thumbs up down below the video, and then make sure you subscribe to Dr. Newman's channel. I'm going to put a subscription link down in the comments below, also in the description, so make sure you go subscribe over to his channel at Dr. Mark Newman.